Welcome, everyone, and thank you for joining today's OnBoard Limited Release Phase 2 Training for Healthcare Providers.
Today's agenda will begin with an overview of the onboard timeline and administration to be ready for Phase 2. Next, we'll go over the details of what is included in the Phase 2 rollout. Previous webinars have shown that there are questions regarding the DME fee schedule, so we will briefly discuss the newly applied DME fee schedule. Next, we will navigate to OnBoard and navigate each step of a DME prior authorization request submission and the insurer response process for DME PARs. Lastly, we will end it where you can go to find resources to assist you along the way. OnBoard Limited Release has begun its three-phase rollout. The first phase introduced medication PARs and Form HP 1.0 submissions and has had thousands of requests navigate the system successfully each day. Phase 2 will introduce durable medical equipment submissions to OnBoard on April 4th, 2022, which is the focus of today's training. Lastly, Phase 3 will introduce the remaining PAR submissions for other treatment and testing. Other treatment and testing: MTG confirmation, MTG special services, MTG variances, non-MTGs over $1,000, and non-MTGs under or equal to $1,000. If you have not set up delegates to draft PARs on your behalf, you can do so at any time. OnBoard Administration ensures that you have the proper access to the system with your assigned delegates ready to draft PARs, which must be reviewed and submitted by the healthcare provider, to draft escalations to Level 2 medication PARs, which must be reviewed and submitted by the healthcare provider, to draft PAR escalations to Level 3 for medical director's office review, to respond to insurer requests for information, which must be designated by the healthcare provider from within OnBoard, and to draft and submit requests for decisions on unpaid medical bills, Form HP 1.0. Phase 2 will introduce durable medical equipment prior authorization request submissions on Monday, April 4th, 2022. As you may have seen already, currently in OnBoard, the only PAR category available for submissions is medication. On April 4th, a durable medical equipment category will be added for your selection. The current version of the durable medical equipment fee schedule is to be used when OnBoard introduces DME prior authorization requests to the system. Let's briefly go over DME fee schedule information. The DME fee schedule lists the durable medical equipment that may be supplied to an injured worker when medically necessary. These must also be in accordance with the applicable medical treatment guidelines. When using the DME fee schedule to determine if a prior authorization request is required, you will locate the item and view the purchase, rental per week, and PAR required columns on the right. Any item that has a purchase or rental price do not require a PAR. Items that do or do not have a purchase or rental price but have a PAR or PAR indicated in the PAR required column also require a prior authorization. Lastly, if an item is not listed on the DME fee schedule, it will require a PAR submission in OnBoard. Not everyone is eligible to submit DME PARs in the new system. Medical suppliers are not eligible. DME submissions must be requested by the provider who ordered or prescribed the DME item, including chiropractors, physicians, physician assistants, nurse practitioners, podiatrists, dentists, audiologists, and optometrists. New York State providers who are eligible for board authorization must be board authorized. To view additional details regarding the DME fee schedule, go to the Healthcare Providers section of the board's homepage and select Medical Fee Schedule. The next page lists all the fee schedules. Locate and select Durable Medical Goods Fee Schedule. Healthcare providers and DME suppliers bill for DME items using Form CMS-1500 and are encouraged to bill electronically through a board-approved XML submission partner, also known as Clearinghouse. The board has provided specific examples of using Form CMS-1500 for the billing of DME items. For more information and these examples, visit wcb.ny.gov/CMS-1500. For frequently asked questions about DME fee schedules, including billing with Form CMS-1500, visit the DME Fee Schedule webpage. The frequently asked questions are available in the Resources section. Now let's dive into OnBoard and begin showing you how to use OnBoard to successfully submit a durable medical equipment PARS. First, we will show you how to access OnBoard Limited Release from the board's website if you have not used OnBoard to submit a medication PAR or a request for decision on unpaid medical bills, Form HP 1.0. OnBoard Limited Release is accessed through the board's medical portal. If you are not registered for the medical portal, view the medical portal access and administration web pages for healthcare providers. In the teal bar at the top of the board's website, locate the Online Services drop-down list on the right. Select the down arrow to display the list of services and select Medical Portal. Then select Log In. Enter your medical portal ny.gov ID username and password to log in to the medical portal. An OnBoard logo is displayed next to the Prior Authorization Request, or PAR, and Request for Decision on Unpaid Medical Bill, Form HP 1.0. These links will take you to your OnBoard dashboard. All prior authorization requests are now done using the Prior Authorization Request, or PAR, link. As mentioned, Phase 2 introduces durable medical equipment PARs to OnBoard. The following instructions will detail how to draft and submit a DME PAR. To submit or draft a DME PAR, select the Submit a Request button on the top right of your dashboard. Then select Prior Authorization PAR. First, you will complete the information for the provider making the request. A provider's name will be selected automatically if submitting on behalf of themselves or if a user is only delegated to submit on behalf of one healthcare provider. If a delegated user can submit requests for multiple providers, they must select the provider's name from a list of providers. If the provider only has one medical license, the form will automatically fill in the license information. If there is more than one medical license, select the correct license from the drop-down list and then the WCB authorization number. Then select Claim Search. To begin your claim search, enter the WCB case number or the claim administrator claim number. Next, enter the information for two of the following four fields, either date of injury, last four digits of the Social Security number, the date of birth, or the patient last name. Then select Search for Claim. If a claim is not matched, check the criteria entered, enter new search criteria, and search again. If there still is no match for a claim, you can continue with the submission by selecting the link to proceed without a matching claim. Then enter the known patient and claim details. After your submission, the board will attempt to match your request with an existing claim. If a claim is found, your request will be forwarded to the insurer's claim administrator for response. If a matching claim is not found within 5 days, your request will be closed and you will be notified. The patient should then be instructed to submit a claim and notify their employer of their injury. When a claim is matched to the search information, search results will be displayed and you may continue with your request. After conducting the claim search, select the Durable Medical Equipment PAR category. Complete the additional fields that appear for a DME PAR. As you can see at the top of our eForm, we have selected Durable Medical Equipment, and the next required field, the HCPCS Code description, automatically appears. Begin typing at least 3 characters of the Healthcare Common Procedure Coding System, or HCPCS, code or description in the HCPCS Code description field. This example shows that L01 has been entered and several items containing these characters appear. Locate and select the correct HCPCS code form from the list. After entering the HCPCS code and description, additional fields are required. Select the MTG Site from the drop-down options. If there is no MTG Site associated with the PAR, then select None. Next, begin typing at least 3 characters of the medical treatment guide reference, and then select the correct reference from the list. Lastly, enter the body part and select the side of the body if applicable. After the information is entered, select Save. The DME PAR item is now added. If multiple DME items are being requested for the patient, they can be added by selecting the Add Another Item button and selecting the durable medical equipment, then completing the necessary information for that DME item. All DME requests will be processed as a single PAR. Remember, when multiple items of the same PAR category are submitted together under the same PAR ID, all items will navigate the review together. The PAR final determination will be made once all items within that PAR ID reach a final determination. If there is a different PAR needed, you may also add it by selecting the Add Another Item button and selecting the appropriate PAR type. You will be prompted to complete and submit additional PARs as separate PARs once the DME PAR has been submitted. If you need to change any information previously entered, select the Edit button. If you do not want to submit a request for a DME item, you may remove it. Once you move to the next screen to complete the request, you will not be able to make changes to the request details. You can save as a draft by selecting the Save as Draft button on the top right of the page. Your draft will be saved under the Draft eForms tab in your dashboard, where providers and their delegates will be able to select it and continue completing the request at a later time. If you entered information for multiple PAR types, each PAR will be saved as a separate entry in the Draft eForm queue. Draft eForms are removed if they are not submitted within 30 days from the date that they are created. After adding all of the necessary items for this PAR submission, select the Complete Request button at the bottom. The next step will be to add the last portions of required details for the item or items that you have added to your submission. You will see the status is incomplete because there are required additional details. Select the Add Details button to enter additional details for your DME request. add the details. For this DME example, the additional detail needed is to enter the duration in weeks. This DME item has no rental fee in the DME fee schedule and automatically shows as 0. This DME item has an estimated purchase price in the fee schedule and automatically fills with that purchase price. If you are submitting a DME item that does not have an estimated rental price or purchase price in the DME fee schedule, but requires a PAR, you will need to enter the required information. Once entered, select Save Details. The details are now added to this DME item. If there is more than one, you will continue entering the required details following this same process for each item. Once completed, select the Medical Necessity / Supporting Medical Documentation button. Enter or upload a document providing all relevant clinical information to support the request. Include narratives, progress notes, and other supporting documentation, for example, symptoms, surgery date if applicable, justification for the equipment, etc., and any contraindications if applicable, evaluation of efficacy to continue or extend the use of the requested durable medical equipment. The recommended document format is PDF. Other acceptable formats are text, spreadsheet, and image. Non-PDF files will be converted to PDFs. The maximum combined total for all uploaded documents is 30 megabytes. To upload a document, select Upload Relevant Clinical Information. Select Browse to locate the document on your computer. Enter a description of the document if necessary. Then select the Upload button to upload the document. You should receive a confirmation that the document was uploaded successfully. If there are more documents to add to your request, select Upload Additional Documents. To continue with the submission, select the Review and Submit button. Review all details to confirm the accuracy of your request. At the bottom, you can go back to the Medical Necessity / Supporting Medical page if you need to add more information. You can also select the Preview button to view the entirety of your PAR in a generated document. Once ready to submit, the provider will select the Attest and Submit button. If you are the healthcare provider, select the Attest and Submit button. Provider delegates cannot attest to, or submit the PAR. If a delegate created the PAR on your behalf, open the PAR from your draft eForms queue and review the PAR details. You may change the request details and statement of medical necessity, or upload different or additional documents if necessary before selecting the Attest and Submit button. As the healthcare provider, you are required to understand all aspects of the attestation presented to you before submitting a PAR. Read the attestation and submission carefully, and then select Submit. A confirmation page will show, confirming your DME PAR submission, which includes the time frame for an expected response. If you are a delegated user drafting the DME PAR on behalf of the provider, you will select the Ready to Submit button rather than the Attest and Submit button. This will save the draft to the Draft eForms tab of the Delegate dashboard and the Provider dashboard for the provider to attest and submit. After the PAR is submitted by the healthcare provider, the drafted PAR for a delegated user and the provider will be moved from the Draft eForms tab to both the Submitted eForms tab and the Prior Auth Active tab. Within your dashboard, you can view the recently submitted item in the Prior Auth Active tab. The due date column will update with the date the claim administrator is required to respond. All timeframes for claim administrator review and response are automatically tracked by the system. If the claim administrator does not respond within the designated timeframe, an order of the chair may be issued. The Current Activity tab will update with the level of review that is requested. An initial submission will be Insurer Level 1 Review. The submitted PAR will also appear in the Submitted eForms tab. The status column confirms that the PAR submission has been completed. When a final determination is made on a PAR, it will be moved to the resolved queue. When a PAR contains multiple requests, it will reach final determination once all requested items in the PAR have reached a final determination. For example, if one DME request is granted and the other DME request is denied at the Level 1 review, both requests will move to Level 2 review and, if escalated by the healthcare provider, to Level 3 review, which is board's medical director's office, together. If one item was granted at Level 2 and the other was denied, the provider can proceed with the item that was granted and can escalate the item that was denied to a Level 3. Once all requests within the PAR have received a final determination, the PAR will be moved to the Resolved tab of the dashboard. It is recommended to check your Resolved tab for final decisions daily. Next, we will show you what you will see when an insurer responds to your DME PAR, including DME PARs that escalate to a Level 2 and Level 3 review, and viewing a Level 3 response. If the PAR is denied for an administrative reason only, or granted by the claim administrator, the PAR will appear on the Resolved tab. If any other action is taken on a PAR, it will remain on the Active tab and will be updated with the new information and shown in bold letters. The Current Activity column will show the current status. The provider and any delegates will get an email or text message based on their notification preferences in the OnBoard user's profile, advising that action was taken on their request. The example on the screen here shows that the DME submitted is currently with the insurer for a Level 1 review and is due for response by October 11th. To review the response from the claim administrator, select the PAR ID link to access the PAR details page. In the Request Details section on the PAR details page, select the Level 1 or Level 2 Insurer Response Details as appropriate to view the full response details. DME PARs that are granted in part or denied for medical reasons at the Level 1 review will automatically be escalated to a Level 2 review. The Current Activity column on the Active tab will show Insurer Level 2 Review, indicating the PAR has been automatically escalated. This review must be done by the claim administrator within the required time frame shown in the due date column. In this example, the current activity column shows the DME PAR is currently in an Insurer Level 2 review status. If the Level 2 reviewer grants the request, it will appear on the Prior Auth Resolved tab. DME PARs that are granted in part or denied for medical reasons at the Level 2 review will not automatically be escalated for a Level 3 review by the Medical Director's Office. After the Level 2 reviewer has submitted their denial or grant in part of the DME PAR, the PAR item will update in bold in the Active tab. The current activity column will show the latest response. Escalating to a Level 3 review needs to be completed within the required time frame indicated in the due date column. In the example seen here below, the current activity is Review Insurer Level 2 Denial and may be escalated for Level 3 review by October 28th. To view the details of the insurer's Level 2 denial, select the PAR ID link and navigate to the Request Details section. To escalate to Level 3 review, select the Actions button on the top right of the PAR Details page and select Request L3 Review. Select the items that you would like to escalate, enter the reason for the Level 3 escalation in the text box, and then select Submit. The escalation to Level 3 will now appear in your Submitted eForms tab. The eForm name will show the PAR type and level of request. The status column clarifies that the escalation is complete. The board's medical director's office will issue a notice of resolution. The determination by the medical director's office on the medical necessity of the DME request is final. The PAR will be moved from the Prior Auth Active tab to the Resolved tab and will no longer appear in the Active tab. It is recommended to check your Resolved tab for final decisions daily. This example shows the PAR status has updated to L3 Granted Final. And Mike, I think we can move to the next slide. Selecting the PAR ID link will open the PAR details page. You will be able to view, download, or print the notice of resolution from the Documents section on this page. The board has developed a training webpage for healthcare providers. Please see the OnBoard webpage for more information. On the OnBoard webpage, a provider-specific card is available for payers, which includes links to an overview of OnBoard training and resources. The resources section will provide you with videos, previous webinar recordings, fact sheets, and contact information. The training portion will provide you with training documents similar to today's webinar. This contains everything you need to use OnBoard Limited Release, including the newly posted DME submission instructions. These instruction pages feature linked sections on the left side of the page. These will take you directly to the sections to view the instructions you need as you work within OnBoard Limited Release. Phase 3 will add treatment and testing PARs on May 2nd, 2022. Prior to Phase 3, we will be conducting a webinar similar to today's webinar. To receive these updates, make sure you are subscribed to receive notifications. You can subscribe to the board's website. For questions or more information, you can send general onboard questions to onboard@wcb.ny.gov. For other questions, contact customer service at 877-632-4996. We will be sending onboard-related emails through WCB notifications, so make sure to subscribe. Lastly, we encourage you to visit the instructions created at wcb.ny.gov/onboard. These instructions dive into all aspects of OnBoard limited release.